Newsradio 700 WLW.
It's called Cyberchondria because we Google all these symptoms and think we have things that we don't. And this is particularly difficult in the time of COVID-19. Dr. Jason West is a integrative medicine specialist and a physician and joins me on the show to talk about it. Doc, how are you?
I'm doing great, and believe me, you're not the only one. So many people are coming in and they type in, hey, I've got this, and all of a sudden the internet tells them that they have some rare thing that they better get their affairs in order because they're going to die.
Yeah, right. Otherwise, it's like, well, were you doing something unusual like lifting? Oh, yeah, you know what? I was putting stuff in the attic in my back, and oh, I thought I had kidney disease. No, you just strained your lower back. You also got to use your head in this stuff, too. And we're probably seeing a lot more of this stuff because we're so hypervigilant about COVID, right? I mean, I just said in the open there that the governor is contemplating whether or not to require everyone in the state, or at least here in Cincinnati, to wear a mask. That announcement could come out tomorrow, possibly. And so now we're hyper vigilant, and everything is magnified, right?
It's true, and we've taken away our normal activities. You know, we said, hey, don't go outside. You can't go to work. We're shelter in place. And so what naturally people are looking for an activity to fill in, and they're saying, hey, I got a hangnail. And the next thing they know, they're like, I think I have skin cancer. I have bone cancer. It's coming out my nail.
Right. Yeah, and I see that especially during COVID. Let me focus a little bit on that before the cyberchondria for a second. You as a practitioner, you as a doctor too, do you believe in the mask mandate? Is that going to do something for us? I just talking to a doctor who called in and he said, well, you know what, I wear a mask and it does help tamp things down, but you're asking us to do something we did for a long time, and it looks like maybe the mask phenomena has faded away. Do you think that maybe because of policies that we maybe overstated how bad the COVID epidemic's going to be, that a lot of people simply disregard a mandate to wear a mask, or simply just say, the hell with you, even if I'm going to get this stuff and die, I'm still not wearing a mask because I'm going to make that choice? How do you feel about that as a physician?
Well, we've made a conscious decision in our office. Hey, we're not going to wear masks, and one of the reasons why I believe that is we studied the literature. We looked at the size of the particles of the virus. We're not deliberately trying to. It's not a political statement. It's just an educational statement of saying, look, this really isn't what is the problem. The problem with coronavirus right now is there's so much misinformation. You don't know what to believe. You know, is the mask helpful? Is it the social distancing? Right. Is it because it's 0.03% or there's all these different percentages of is it happening or not? And then we're looking at Italy and we're looking at China. Is there a second wave over there? Well, we haven't heard anything yet. And patients that are coming into my office, a third of them are literally in a bunker somewhere chewing their fingernails thinking the world is going to end.
Sure.
A third of them are say, to hell with this, I'm not doing anything. You know, I'm going to live my life normally. And then there's a big section in the middle that are like, oh, we just don't know who to believe or where to turn.
Okay. And I get that too. And you know, I don't think that first of all, when you look at the hierarchy of blame, because that's what we do as human beings, specifically Americans, we like to point the finger and say, this is all your fault. Instead of pointing the finger at Amy Acton here, who was our public health director in Ohio. She caught a lot of arrows. Mike DeWine, our governor, did too as well. I think first you got to lay this at the feet of the Chinese government because of the cover-up, because of their inaction, because of their lies. Let's face it. Do you really think that 3,000 people, and only 3,000 people, are dead in China where this virus started? The answer is not only no, but hell no. It's probably in the millions. They're just not going to tell you. So that hurts everybody else in the world that they're trade partners with. Furthermore, when you hear the CDC come out and say initially, well, we messed the testing up. We don't know who to test. Should we test and contact tracing? And then the mask thing. Don't wear a mask. Well, wear a mask. No, don't wear a mask. Yeah, wear a mask. When you get the people at the top who are supposed to be on top of this stuff sending the public like me mixed information, that's problematic. And so it makes us less likely to conform when we really need to.
And I totally agree with you. Matter of fact, I've been asked on numerous podcasts and interviews, Dr. West, what do you think about the second wave? And I'm like, well, I don't even know what I think about the first wave. Certainly there's something going on, and you see the infection rates, and you see the symptoms and everything, and really the doctors that I work with inside of our office, we just had this discussion yesterday, and we're like, probably the most accurate thing to follow is the death rates. And are the death rates that much different from 2018 to 2019 to 2020? and they don't look a whole heck of a lot different. So again, we're trying to navigate this just like everybody else is.
Mm-hmm. Dr. Jason West, integrative medicine physician and expert in what we're talking about, and that, of course, is everything from COVID to cyberchondria, because people are worried about getting COVID, and so now they're Googling symptoms. It used to be we Googled a whole bunch of symptoms on occasion, and now I guess the interwebs are breaking down. One of the most commonly Googled things now is going to be types of different symptoms for ailments, because on top of COVID, we are hyper vigilant when it comes to disease and illness right now. So everyone is trying to self-diagnose themselves, which is a problem, right? Because I'm looking at a study here that says online symptom checkers are accurate about a third of the time. A third of the time. So when you type your symptoms in and search for them, and I know there's some algorithms out there that will say, okay, you possibly have this, possibly have that. It seems like it's always the worst of what you have. And is that a good, I guess in a sense, I mean, we know we've made medicine more accessible to people by allowing Google to do what it does, but at the same time, it makes it harder for doctors like you, doesn't it?
Well, it's really a mixed blessing or a mixed curse, depending on how you look at it. But it's so helpful when people come in and they're educated on, hey, I better move more. I better drink more water. I should decrease my blood sugar. I should decrease my blood pressure. The bad thing about it, and I just had this happen yesterday, is that a patient come in with a list of symptoms and said, hey, I went to the internet. I have this, this, and this. And I felt like it was a contest of, well, who's smarter? And I just wanted to tell the patient, you win. Like, I'm not, it's not a intelligence competition. If you want some help, this is what I would recommend. And then on the flip side, and I even tell this to patients, look, here's what's wrong. Here's how we're going to fix it. Should we jump on Google so that we can just like get rid of the craziness before you leave? Because I know you're going to walk out of the office and type in, he told me to do this. And just like anything else, you're going to get good information and poison information from that.
Right. And a lot of conflicting information, and then it just makes it look like you don't know what the hell you're talking about, which may be the case. But again, if I'm going to you, I'm guessing you kind of know what you're doing. You got degrees in the wall. You've got the jar full of tongue depressors, and more importantly, you've got a white lab coat. So I trust you, Dr. Jason West. I trust you. But I think the other element of this thing too is that people go in and self-diagnose and enter their stuff online, and some sources are better than others, obviously, too, but it makes it a lot harder, I think, for a physician to do their job. And furthermore, we tend to distrust then the medical community, and I think that there is also an effect in this, too, when we get misinformation online, and it doesn't jive with what public health officials are telling us in the age of COVID.
You're exactly right. And it's just such a good, bad thing to have access to the information. I mean, I started practice 20 years ago, and you could literally say, hey, this is what's going on. This is what I'd recommend for you. And if it's just reasonable stuff, you need to move more, stop eating bad food, stop doing bad, ergonomics, and people would be like, great. Now it's they're listening to you, and I tell them, I know you're going to go look on this on the internet. Let me help you to be a resource, and let's get on the same page, because confusion makes it so that you don't get very good patient outcomes.
I will say this, though, defending food. If bad food tasted good, because bad food tastes good, if good food tasted good, we wouldn't have this problem. Why not make the good food taste as good as the bad food?
Well, and the problem is you've got these food engineers that they're engineering things. Correct. That just make it great. And
you need to hire them now, make the vegetables taste better. I mean, I could have 4 cheese conies right now, bang those bad boys down, some fries, no big deal. That tastes a lot better than a plate of broccoli. Let's get some food engineers on the veggie side of this to straighten this out.
Well, what I tell people is this is a really good test. If you're eating a food that doesn't have a shut-off valve, it's not good for you. Like, how many Oreos can you eat? Well, you eat it until the
That sounds like a challenge, son.
Yeah, exactly. But how many apples could you eat, or oranges? You can eat 1, maybe 2, and your body's like, I've had enough. But we've engineered some of the good food, and trust me, like, this is a discussion every day that I have with people, and I'm saying, look, you got to make sure that you're eating foods that have a shut-off valve. It's a simple test, and your body will thank you in the long run, because you're reducing risk factors that are going to make you sick later.
Yeah. All right. Dr. Jason West on the show this morning with Sloaney on 700 WLW's integrative medicine physician. We're talking about cyberchondria, and that is in the age of COVID. Everyone may think they're more in tune, I guess, with illnesses because you start sniffling or, you wind up coughing and you go, my God, I got COVID. No, you just breathe some dust in. That's all it is. Or you got something in your eye, whatever it might be. And honestly, with COVID, though, some of these symptoms that they're saying now are really weird, Doc. Like, we heard about your inability to smell or taste or something like that briefly, maybe. And I saw some new ones. I forget what they were, and they were really weird. You know what I'm talking about?
Yeah, for sure. They have something called COVID toes. I had a discussion with the patient last night that's saying, hey, I got COVID toes. I know I have coronavirus.
What the hell's a COVID toe? What is that?
It's where you get a rash on your feet, on your toes. And it's one of the things that goes along with loss of taste, loss of smell, dry cough, fever. And now there's more and more doctors saying, hey, I saw something on their feet, and they call it COVID toes. And then I said to the patient, well, what's going on? I've got coronavirus. I said, what did your test say? Well, I don't have any testing, but I got COVID
toes. So don't have the test to confirm whether or not you have the antibodies. Just go with whether your feet has a rash on it.
It's so fascinating. I mean, I've been called from all over the country of people saying, and this is the tragedy part, is people saying, hey, I went into the hospital system. I have coronavirus. Dr. West, what should I do? And I'm like, well, what did the test say? Well, I didn't get tested. It's just the hospital said I have it and I should go home and self-quarantine. And then you get people all over looking for things. And I even had to look up COVID toes because I thought, I wonder if this is accurate. And it says,
wait a minute, you Googled it? Isn't that the purpose of this conversation?
Well, I went to Dr. Google just like everybody else, but then I did a PubMed search, and it says that some cases can be associated with COVID toes, but it's not pathognomonic, which means it's not cardinal or essential for a coronavirus diagnosis. But your point is, like, I got caught in that thing too, and I'm like,
damn it,
go find some information.
Yeah, right. I Googled it, and now I'm scared. So, hey, Dr. West, I appreciate it. A lot of fun. Love to have you back sometime. Thanks again, and be well, okay?
You're welcome. See you later, guys.
All right, take care.